My name is Ajenthen, and I also presented yesterday. And I want to present this study for Christian Laugesen, the handsome guy you have up there. The study title is pen-administered low-dose dasiglucagon versus usual care for prevention and treatment of non-severe hypoglycemia in people with type 1 diabetes during free-living conditions. These are my disclosures. I showed them yesterday as well, but today I want to emphasize that this study was an investigator-initiated study. We only got the drug from Zealand Pharma, data analysis, interpretation, and so on. They were not involved in that. The agenda is 3 points. First, the rationale, the study design, and the key results. Yesterday I talked about the rationale for using a glucagon, and one of them is that we know that persons with type 1 diabetes have an increased risk of having a severe hypoglycemia due to the intensive insulin therapy. And the treatment for non-severe hypoglycemia nowadays is fasting carbohydrates. This, however, leads to excess of carbohydrate intake or calorie intake and promote weight gain. It causes a rebound hypoglycemia and also discourages people from exercising due to the fear of hypoglycemia, and then again promotes the risk of weight gain. So we need an alternative treatment, and we suggest to use a low-dose dasiglucagon as a non-caloric tool for treating non-severe hypoglycemia. I showed you this graph yesterday. It's an in-clinic study where carbohydrates were compared to the two doses of dasiglucagon. And you can see that dasiglucagon has a faster recovery and a higher potency in rescuing hypoglycemia than carbohydrates. But we wanted to see whether this works in the free living conditions. And that's why we did this study with the objective to evaluate the efficacy and safety of and feasibility of pen-administered low-dose dasiglucagon for prevention and treatment of non-severe hypoglycemia in people with type 1 diabetes during free-living conditions. The study design was a randomized, open-label, 2-period crossover study where we enrolled 24 participants with insulin pump-treated type 1 diabetes. They went through a screening and were randomized either to dasiglucagon for 2 weeks or usual care for 2 weeks, had a washout period of 5 to 7 days, and then they went to the alternate treatment and then again followed up 4 weeks after. The inclusion criteria are, as you can see here, they were adults with type 1 diabetes, has insulin pump therapy and a glucose sensor. These two were not communicating. The HbA1c was below 8.5. They had to perform more than 2 times exercise per week and have quite a lot of hypoglycemia to be included, 4 hypoglycemias within the 14 days. During the intervention periods, they wore a Dexcom G6 sensor and were also also received a Dexcom receiver where they could both time and register the dose of both carbohydrates and dasiglucagon in the system. So they had a real-time registry of the events. Further, they also had to register the time and intensity of the exercises. And during the day, they will also have to register on a questionnaire whether they had any adverse events and how intense these were. In the usual care period, they had to use carbohydrates, but we didn't have any restrictions on the timing, the source of the carbohydrates, or the amount that they should use for these hypoglycemic treatments. In the dasiglucagon period, we told them to use a fixed dose of 80 microgram dasiglucagon, but this pen was designed to use either 40 or 160 microgram glucagon, and the timing of the intervention for hypoglycemia or the amount was also not restricted here, but we recommended 80 microgram. However, if the glucose level was below 2.2, we recommended them to use whatever they normally use. And the participants were actually also allowed to consume carbohydrate if they, for whatever reason, prefer to do so. The primary endpoint of this study was percentage of time in target glucose range measured with these glucose sensors, and the range was 3.9 to 10. Let's move on to the key results. First, baseline characteristics, and you can see 24 participants, 48% females, age 44, diabetes duration 23, HbA1c level of 7.3, and a BMI of almost 28. Let's look at the flow chart of how dasiglucagon was used and rescue carbs was used. This can be a little bit complex, so bear with me. First, if we take the dasiglucagon, you can see that 75% of the hypoglycemic events, they used dasiglucagon. If you take this and look at the different doses, 91% of these interventions were 80 microgram. If you look at the treatment and prevention, there was 50-50% on treatment and prevention of hypoglycemia. And if you look at whether they used it once or they used it several times for a hypoglycemic level, it was 75% for once and 24% for a multiple. For the carbohydrate or the usual care period, they used carbohydrates, and as you can see, there was around 500 events, and the median was 16 events per participant in these 2-week period. And again, the treatment prevention ratio was 50%, and again, single and multiple usage for the hypoglycemic events was 75-25%. Let's go to the primary endpoint. And the primary endpoint was time in range. And you can see there was no significant difference between dasiglucagon and usual care. However, there was a slight tendency for dasiglucagon, but non-significant. Also, if you look at the time below range, it was lower for the dasiglucagon and also lower time above range, but again, non-significant. Let's look at the events itself. So, like I showed you this figure yesterday, and here you can see the change in glucose within 30 minutes after a treatment in the DASI group and for the usual care. And there was a significant difference in the increased change of glucose in this. But another way to look at this is with a -1 Kaplan-Meier curve, where you on the right side have the percentage of hypoglycemic events that was treated, that reached or was successful. And on the x-axis, you have the minutes of after initial treatment. And what you can see is that there was a significant faster recovery rate for dasiglucagon compared to usual care with 44%. Another interesting topic is the total daily carbohydrate. The participant, they registers all their carbohydrates in the insulin pumps. So we have a quite fair knowledge on how much they use. And here you can see that the total daily carbohydrate intake was reduced in the DASI group with 11% in this 2 weeks. And this was mainly driven by the, of course, mainly driven by the carbs used for the rescues in this group. In terms of adverse events, there was more adverse events reported in dasiglucagon, and this was mainly due to nausea and headache. But if you look at the intensity of these headaches and nausea, you see they are quite mild, and they was also described quite transient. We also made a patient-reported outcome, and I know these results are maybe also due to the study design and maybe biased by the patients and participants we have involved in the study. But nonetheless, we see that 96% of the participants were more likely to include dasiglucagon as part of their routine care in this study. So in summary, the use of low-dose dasiglucagon resulted in modest improvement, non-significant improvement in time in range, time below range, and time above range. There were faster hypoglycemic recovery with dasiglucagon, and there was a significant reduction in the carbohydrate intake during the DASI period. In terms of adverse events, there were headache and nausea, but they were mild and transient, and 96% of the participants were likely to use dasiglucagon in their routine care. To conclude, low-dose dasiglucagon was effective and well-tolerated treatment for non-severe hypoglycemia, and these data support that the continued study of low-dose dasiglucagon can be used as a non-caloric alternative to carbohydrate for the management of non-severe hypoglycemia in people with type 1 diabetes. Thank you.
Thank you so much. Any questions? Yeah, Donate.
Thank you, great talk. I noticed that in the DASI group that they had a lower number of, on average, of intervention.
They had a lower, they had a numerically lower number of hypoglycemic events. Yes.
Okay.
450 versus 500. So.
Do you think this is because of treatment, or it's some other?
So it was not significantly different between those two. So it's really difficult. And yes, of course, there may be some kind of that when you have a glucagon pen, you may be more aware of your hypoglycemias, and maybe you have less hypoglycemic events during those 2 periods, 2 weeks period. So yes, definitely.
Yeah, I think.
Hi, maybe I missed it. Do you know how often then people use carbohydrates after injecting first? With
Actually, And I don't remember the numbers, but I have them here. We have looked at that as well. It was so as I told you, the 75% was multiple, or 24% was multiple, and among them, I think half of them were carbohydrates. I cannot. I have the data here if you want to see it. Yeah.
And did you have participants with, for example, bowel problems, or
No. We excluded on gastric paresis.
I mean, for them it might be particularly interesting because then the timing for when eating things becomes very.
Definitely. It may be a different output or outcome we will get, but we wanted to have it quite. We wanted to have a group that had a lot of hypoglycemias in order to have enough event to do any statistical rationale on it.
Just a question about the formulation. You can keep it out of the fridge. Do they just keep it in?
Yeah, you can. Yes. Yes, you can use it. It can be out of the fridge for 6 months.
And were they using the alarm on the Dexcom? So the minute it alarmed at 4.5, they would take it, and did they treat it? Was there a difference?
Yeah, so the alarms were set to 2.2. The alarms were set to 2.2. So it was not on 4.5 or 3.0 or anything like that, no.
Yeah, just one question from me. You had some of them on the 160 milligrams of dasiglucagon. Did you see anything different compared to the 80?
Like on the glucose response, you mean?
Yeah.
I haven't digged into that part. We haven't but we have a fine. It's a lot of events, and it's really complicated to make it a single message with all those kinds of events. But we wanted to do it as free living as possible, just to see what is it that the participant wanted. But yes, definitely we are looking into that as well.